I'm glad. Welcome, everybody. I'm glad to see you. The last time I saw you, it was warm weather. I hope you're surviving the colder weather now. And I know many of you may be already involved in needs assessment, and we hope this is helpful. Just like with the course, although this is a Zoom meeting, I would really like this to be interactive, and I would like to ask questions, and I hope you all would be willing to speak up and talk. And again, this is for you all and not for me. So if you have questions, if you have different disagreements or a different point of view, please use this time as to what helps you. We're not going to talk about needs assessment, but we're going to go into part 2. This summer we did part 1. It basically talks about health problem analysis. Next slide. And you can click again so that the other piece comes up, Ashley. As we talked about this summer, needs assessment is not something you assign over to the data team to go off and do on their own. And if you do that, you're in trouble even before you start. Needs assessment is part of a larger planning process, and it needs to be integrated into that larger planning process for it to be effective. Again, a planning process is the only way to be effective in public health. So even if you are assigned the task, because sometimes you have no choices on what you're assigned, you still need to try and operate and work and think through, check out, get feedback as part of a larger process. Next slide. Needs assessment, again, when this came out in some of the first rounds, everyone saw it as a big, pretty book that you could give out to everybody and show your state's MCH problems. That's a great tool to have, but that's not needs assessment. Needs assessment is really the systematic collection examination of information to assess and prioritize the needs of the population. And that assessment and prioritization should be leading you to formulate a plan that leads to your next steps for public health action. And if your needs assessment doesn't fit in and guide and direct and help with that planning process and help with that decision making, then you're really not doing needs assessment. Next slide. You can click on it again. So when you think about needs assessment, you need to think about who, what, when, where, how, and resources. But that question should be asked at a larger needs assessment level. Those questions are important for the needs assessment, but the who in the needs assessment is driven by who's responsible for the plan, who needs to be integrated. I mean, it's not about giving the plan over to the programs and the needs assessment to the data unit. They need to work together. And the what and where and how and the resources are all part of that larger effort. Next slide. When we went over needs assessment this summer, I talked about 2 parts. The first part being health problem identification and measurement, what it is, and then prioritization. We talked about different methods, different ways you could get the identified problems. And we talked about some of the qualitative pieces and the quantitative pieces, and you can identify what those problems are. You can try to define what those are. We talked about how you could prioritize them. I gave you 2 more sophisticated methods. You and I talked about Q-sort versus trying to do a scoring-based system. You could still vote. You still could do consensus, but each of them have their strength and weakness. But you're trying to get a group process because you're trying to get everyone on board cohesively towards going forward. The other part I talked about was part 2. And let's go to the next slide. Part 2 looks at the analysis of that prioritized health problems and tries to dig down in, because you can't do a plan for your priorities if you don't understand your priority problems. if you've not dug into them to make sure you understand the problem as it relates to your particular state or community, then you really can't develop a plan. I remember someone immediately coming up and said, yeah, our problem is preterm birth. And they're going to say, so that's no problem. We'll start a newborn home visiting program to address preterm birth. What's the problem with a newborn home visiting program? Newborn home visiting programs occur after the baby's born. They're already preterm. So if your focus is on preventing preterm, that's the wrong program. So the idea is when you have a prioritized problem, people always have ideas of solutions, but you don't know if those are the right solutions for your community if you don't dig down further into the problem. And then assess the potential strategies for those targeted aspects as it relates to the data that you have. In other words, do you really have a data-driven plan, or do you have a plan that you're going to try and carry out that you want to collect the data with? And the hope is you're using your data and information to guide what you're going to be trying to do. My problem that I see frequently in the Title V needs assessment process is the needs assessments every 5 years, and many agencies spend most of their resources doing Part 1 and haven't really done any steps towards Part 2. So they come up, they develop their plan based off of their priorities, but they don't understand their priorities. They don't necessarily understand it in their community. They really don't know exactly which strategies would work best given the way their community defines it. So I tend to say, don't spend 90% of your time and resources on Part 1. You'd be better off spending 90% of your time and resources on Part 2. Because as I mentioned at first, there are many MCH priorities. You cannot deal with all the priorities that are out there, but you need to choose ones you can work on. But more importantly, you need to develop plans that will actually have an impact. So you need to know your problem. Now, frequently what will happen though is the timing is you start your needs assessment late. You're going to be lucky to get your prioritization done and get your plan done before the deadline. And that's not a problem. We've talked about how needs assessment doesn't stop. It's not a one-time deal. So you can build into your plan for year 1, digging in and doing a problem analysis and better understanding your problem, and even state up front, you may revise your plan based off of that further analysis. And frequently you need to do that because the data that you need to do for Part 2 isn't immediately available. You didn't have it as one of your PRAMS questions. You didn't have it as one of your BRFS questions. You didn't have it in your youth surveys. That's fine. So then what you do is you plan to put that in the next time it happens. And then when that data comes in, you revise your plan according to the new information. This is sort of a different concept than many are used to. Does this make sense? What are your thoughts? Go ahead. Go ahead. I'm sorry.
Yeah. Actually, now we are doing the need assessment in our state, Louisiana. So, but the Title V need assessment staff always request us to do the analysis first, and then they prioritize the health problems. So look like the order between Bac 2 and Bac 1 not the same, not the same thing. So is that does that make sense if we do that?
Well, again, this is all an art to how you reach decision. The big thing gets to be is you want to make sure you give adequate data and information to develop a strong plan. Now, the problem gets to be is frequently the data analysis that they ask you to do is the data analysis needed for prioritization. In other words, they tell you just enough information to talk about the severity of the problem, the extent of the problem, and whether it's there in the population or not. But that is not sufficient to develop a solid action plan. Does that make sense? In other words, you do need data and enough data to prioritize your problem. But the data you had to prioritize your problem is not sufficient in enough detail to actually develop a clear plan. So my suggestion to you would be make sure that they have all the information they need, or that you go back after they've prioritized and provide further information.
Got it.
Does that make
Thank
sense?
you. Yes, Professor. Thank you so much.
I mean, people oftentimes used to ask, well, what's our plan for the data unit? And I said, as soon as I know your priorities, I'll know what the plan is for our data unit. Because our data unit's priorities ought to be focused specifically on what you all identified as problems that we need to be working on. So yes, you need data both times. You need data for part 1 and data for part 2, but the data for part 1 is not sufficient for part 2. Any other thoughts before we go on? Next slide. So this is my list of how I do a problem-oriented needs assessment. Just so that you know, I've done needs assessment from the first time the federal law required it. And I've either done them, been over the people responsible for them, been a consultant to help develop them, or been a participant. I think this new needs assessment will be the first time that I've not ever been involved. And that's because I'm required, and there's state rules that say I can't be for the first year. But the first thing you want to do is you want to dig into the literature about the issue. And you want to do it from both a problem perspective, but also from an intervention or solution perspective. You want to understand what the literature knows. You want to choose and or develop a theoretical framework to look at, analyze, and understand that problem. In other words, it's not just a bunch of data. You need to put it into a framework that will help lead to decisions and direction. Then once you have that framework, you want to gather readily available information that you can use to fill it out. You want to choose and frame and choose the critical questions that are not answered that you need to really do a better decision making. Then choose, develop methods to answer those questions, analyze them, then summarize them, and then present the results back in a way that they can be used. So we're going to walk through and talk through this for part 2 and what you really need to do in terms of a health problem analysis. Next slide. I like this slide because I really think it helps people understand what we're trying to do. Teen pregnancy is caused by family breakdown. Teen pregnancy is caused by welfare. Teen pregnancy is caused by sex education. And here I thought teen pregnancy was caused by teen sex. In other words, when you start looking at a health problem, there's many aspects and factors that contribute to that health problem. And we need to develop a framework that helps us further understand that health problem and how it works. Next slide. Now, when you talk about theories or frameworks, sometimes in the literature, someone will have published a framework that they've developed, and that's a great thing to start with. Some people prefer a pre-seed, proceed model or some sort of health education model or framework. Some prefer health socio-ecological theory. Almost every problem analysis needs to use that theory because it's really part of every public health problem. I'm going to share a very sophisticated one, not that you should use it, but just to show you that they can get really complex. You may choose that's too complex, but at least have you be aware. And then I show you a simple way that you can map out a problem if you can't find something that you prefer. Next slide. Again, the sociological ecological model should be part of any problem that you have. There are individual factors, there are relationship factors, there are community factors, there are societal factors. all which contribute and all need to be part of your action plan. And so your data analysis needs to look at it from multiple parts. Next slide. This is the GLASS framework that I told you was complex. We're not testing you on it, but I just put it in there so that you can see it. Next slide. It starts out with the underwater risk factors. This gets down to the individual, the biology. Believe it or not, social issues cause health problems, but the way health issues cause social problems is by doing something that's biologic, something that impacts the biology. And so whether that's a genomic level, a molecular level, cellular, multi-organ level, there's on those underwater risk factors that you may want to look at. The easiest way to think about them, medical conditions that you may have or other issues. The next slide. The uphill factors are those things that are up and above and outside the individual. And this is where you start getting to the socio-ecological theory, where they talk to micro, meso, macro, and global levels of a problem. There is a time perspective. These things change over a timeline. You got to realize, especially as there's development with a child. And the macro level leads to the embedment in the micro or underwater level. And then the others are true as well. And then, of course, you get into human behavior and actions and how that may affect things. Again, this is complex. I put it out there so that you can see that there are really deep ways to think about some of these health issues. Next slide. Well, there's a simple way, and I frequently do this when I have groups that disagree over what the problem is. And so by mapping it out together, we can get agreement on what the problem is and work from there. So for example, if the problem is teen pregnancy, you said the mom said, well, it's sexual activity or continuation of sexual activity or use of contraception or direct factors that can cause teen pregnancy. But there are a lot of secondary things that affect the initiation, continuation, and use of contraception. And those factors are the secondary factors that are out there. And then you have the tertiary factors, those things that drive and affect the secondary factors that are there. But the idea here is you can then put everybody's thoughts about what's causing the problem on a single map. The other reason I like this problem is the next slide. The problem-oriented approach not only looks at the causes of the problem, but it also goes down and looks at the consequences. Teen pregnancy leads to abortion, leads to live births, leads to prematurity, medical complications, school dropouts, poor growth in environment, limited maternal skills. And so they lead to secondary and tertiary factors. Why in a needs assessment and health problem analysis would it be helpful to look at consequences? When you're trying to rally support, go ahead. You wanted to say something, please? Go ahead.
Yeah, like you can also anticipate other issues that will be connected to that if you look at the consequences.
Absolutely. And those connected issues might help you recruit partners to help you work on the problem. In other words, they may not be motivated by parts of the problem, but if you can start talking about how this affects poverty or how this affects economic development, then the business people and the other people may become more interested because they realize there's a cost to it. So the benefit of consequences is when you're trying to develop support for your plan, it's helpful to know how everything impacted so that you can get it to maximize the partnerships that you have. Go ahead, next slide. So once you have these frameworks, whatever you choose it's going to be, you can start out and get available reports and look at the data you have. You can do literature searches. You can talk to your data people. You can talk to your community people. You can look at other needs assessments that people had done to get their information and help it feed it. You can look at your program data and information. You want to hold off on immediately collecting new primary data because you want to look at what you already have available to best decide what to do. The other nice thing about the data gets to be is really helps you then start to paint the picture. Next slide. Once you have that framework, think about it as you're creating a picture and you're going to paint by the numbers. So you lay out the framework of your picture first, and then you start filling in with what you know and what you don't know. And so you start filling it out. What's nice is you can adapt that framework to your community. It's easy to start filling in your data. You can use both the general data that you know about the issue, but you can start plugging in your own community data to lay it out. And what it does is it defines what you really know about the problem, but it also shows you what you don't know. For example, many people saying certain things are risk factors, and you go in the literature and you collect the data and there's nothing to support it. That's very, very helpful in saying, well, we can't really address that aspect because we can't find anything on it. So it's a way of quieting some people. I had people who had certain agendas of what they really wanted there. And we said, fine, we've done the data search. We looked at the framework. We can't find anything on it. If you can find something on it, we can focus on it. So again, it helps you know what you know, and it helps you define what you don't know. Next slide. And so once you look at that framework and you start to understand your problem, then you can figure out if you have any really critical questions that you need answers to. I bring this up because I will tell you in my career, 90% of the questions I got are nice informational questions, but most of them are not critical. How, as a data person, can you discern whether something's a critical question or a nice to know informational question? Well, the way I did is I turned and said, okay, let me give you the answers. Okay. If I tell you this is an issue, what are you going to do? If I tell you this is not an issue, what are you going to do? And if you're going to do the same thing, whether it is an issue or it's not an issue, it's not a critical question. In other words, sometimes a lot of program people and a lot of people always have questions and they'd like to know more. But if it's not going to change your public health actions, it's not a critical question. In fact, you can turn that around. If answering that critical question does not lead to a public health action, then it's not critical. It may be nice, it may be important, but it's not critical. Now, do I still have to answer some of those nice and important questions? The answer is yes. I'm not the sole decision maker, but it's a way of helping you think through what's really important and what's not. And it's all about the actions that you're going to take place. So what do you gain by answering the question? What are you going to do differently with the answers? Can that question really be answered? I mean, some of the questions they give me are really outside of what we have any ability to answer. What will it cost? Can we afford it? Will it add to our action plan? So once you look at the framework, you start figuring out what you need to know to really be able to address the problem well, and then you figure out whether these questions are important or not. Next slide. Once you know those critical questions, then you can choose what are the best methods that you can do, what can you afford to do, what time frame do you have it in. You can then analyze the answers. The biggest thing I'm going to come back to is, though, frequently as data people, what we do is we have a tendency to come back and then give people all the data to answer the question. You know what happens when you give somebody all the data and everything that you know? They start staring at you, totally and completely lost. So the other thing you need to make sure you do when you go through these critical questions and you try to answer them is really be able to summarize your problem and be able to present clear and succinct results. You need to do that in a way that's clear and does not lead to paralysis, because I can tell you that many times people give more data, but people don't know what to do with the data that you gave them. You need to figure out, what I call is you need to figure out the story. What's the message here that's really going to help us with the action? Next slide. So yeah, those results should be, what is a statement of the problem? When you figure out your problem analysis, you need to do your problem trends, talk about the individual contributors, the strengths, the community contributors, community strengths, and then you need to describe the relationship to the action plan so that you're summarizing it in a way that the group can respond to it. Next slide. You may not remember, it's only been 6 months, but I talked to you about our late prenatal care problem and the needs assessment we did for that problem example I gave you in the summer. And I talked about how we broke it down and came out with the different factors. Next slide. I told you what the factors were. None of this has data in it. I didn't present any data. I just told them what the issues were, and we developed groups to work on them. In other words, your summarization doesn't need to be overloaded with data. It needs to give them the right messages based off the data, and you need to be able to justify it by the data that you have. But when you give them the answers, you need to give them the answers in a clear, understandable way that leads to action. When we did this, we knew about some of these problems, but for example, when we did our needs assessment, no one knew that unintended pregnancy was causing 2/3 of the delay in our prenatal care initiation. Totally and completely unknown. No one had ever associated family planning and issues with family planning as being a contributor to our poor prenatal care participation. So this thing can be developed and you can turn that data in a way that it's useful. Next slide. So when you think about needs assessment, again, it needs to be integrated into your larger planning process. And so I'm going to talk about how your needs assessment actually can feed into your plans. And so that it's not like you did the needs assessment, you stop, now you go off to your plans. Your needs assessment, the data you have, the information you have actually plugs into your plan. Let me give you some examples. Thank you, Ashley. Next slide. Problem analysis. Let's say our priority is that we have high deaths for children due to poison consumption. And we figure out the biggest problem is they're ingesting poisons. And so they're doing those poisons. And the way they do it is because they get access to it. So that our solutions need to work towards preventing access to the poison. Next slide. So that problem analysis can be slipped around into being a program hypothesis. Our goal is to reduce childhood poisons. The way we do that is reducing poison consumption. The way we're going to do that is we're now going to start providing child-proof containers, or we're going to start locking cabinets so kids can't get into certain cabinets. But again, we can take that problem analysis, those things that we did to better understand the problem, and flip it into now forming our program hypothesis and our plan of action. Next slide. Because if you look at a program hypothesis or a plan, you have a goal, you have policies, you have program you want to do, and you have operational objectives. And so your data that you use, if you're collecting the right data, the needs assessment, the health problem analysis, can actually contribute in many parts of this. Next slide. The other thing is this is what problem analysis would look like that one state, Florida, did here, looking at short pregnancy and unintended pregnancy. Shows you how they actually formed all of theirs for their secondary analysis so they could understand what their issues with, and they used this to help them get the data that they needed for their needs assessment. Next slide. But then they could take those pieces and actually build their logic model framework because they now know their outcomes. They now know their outputs. It actually gives them ideas on what their activities are going to be. So the data in your needs assessment of health problem analysis should literally be integrated into your logic model. Next slide. And here's what their logic model was based off their needs assessment using that framework that I presented to you. So again, it's not the problem analysis is not wasted effort. It really drives your plan. It feeds your plan. They're integrated, and they make sure that your plans are data-driven. Next slide. So again, being effective in public health requires that needs assessment, but that needs assessment needs to be part of a larger plan. Go ahead and click on it, Ashley. So again, it needs to be integrated. You've already heard me say that you may not be able to do part 2 in time that part 1 is due. That's fine. Start doing part 2 in year 2. You did your needs assessment now. Year 1, I mean, start doing your problem analysis to make sure the plans you develop are correct and are really the right ones and driven in the right way. It's okay. Needs assessment is an ongoing process. Frequently, as I said, you can't do phase 2 until you get the new data from the new surveillance system. So it may be in year 2 or 3 before you have the data you need to do that problem analysis. But even though you started, it doesn't mean you don't have to do the problem analysis. You will not help the team, you not help your agency, the public health, address that issue without getting the data they need at some point. Next slide. So let's talk about needs assessment issues that you will encounter. First, you might find that there's limited commitment. So if there's limited commitment, you define what's possible given those limited commitments. You may have limited staff time, so you find ways to recruit others to help you. There are maybe others interested in your priorities that would be willing to take the lead on doing some of the work. And it's okay to have partners help. You have limited resources, so then you define what you can do within the existing resources you have. I've been there when there have been budget cuts and we could only use existing resources, but we did the best we could. You have limited data, so you prioritize doing further assessments into the future. You have limited ability to create change. So you keep your current priorities, but you better define your actions based on the data that you have. So you can't change what your priorities are, but you can change the way you're addressing them. If you have a hierarchical decision-making in your agency, then that's fine. You feed the data in such a way that it feeds the agency's decision-making process. Data can drive decisions in many ways. If you have a fixed MCH budget, then you need to use that problem analysis and people to help write the grants or other things to get the resources that you now need to address the problem further. Next slide. So are there questions before we get into needs assessment debates? Questions, comments, thoughts? Is what I'm saying making sense?
I have a question about just bringing data from different sources together, different reports together, and just being able to understand like the problem through that. Like what is an example of a best approach to doing that when you can't really combine this data together, but you're just looking at different facts and figures and trying to make sense of what the literature in these reports are saying?
What I'm trying to refer to there is you can use the literature to define what the risk factors are for a problem. You don't have the ability to go back and do another risk analysis. If you did, it probably is not as good or sophisticated as already done. But then you can look at their risk factors and look at the prevalences in your community and use that to feed how that risk factor approach works. Does that make sense? And then if you actually don't have that data for your community, but you know what it is for the state or for the nation, you may have to use their data until you have better data for your own state. So it's your picture is not perfect. Painting by numbers, if you've ever seen one of those pictures, they're not perfect. Some parts end up coming out looking better than others, but at least you know the best of what you know. So usually when you're using others' data, you're using that to help figure out how the different risk factors and assets work and relate to one another. And you want to get as close to your community data as you can, and then use other people's data where you have no choice. The nice thing is you know where the data came from, so you can even talk about the certainty level of that data for your community. Does that make sense?
That makes sense. Thank you.
You're better off knowing what you can know versus what you don't know. And then sometimes, to be honest, you just need to tell them, we just don't know. I'm using this because we have no better data. But this is the best that we have to go from. Other questions or thoughts? There is a tendency in programs to go ahead and say, well, if this state did these programs to address their problem at work, I can do those same programs in my state. And that depends on whether your problems are the same, your risk factor prevalences are the same, the way your culture and environment works the same. You have the same policy, infrastructure, support, and resources. So you can't just transport one thing to the next and assume that you're going to have the same result without doing some sort of assessment to determine fit and appropriateness for your community. So what are some of the debates? Well, some people say, should your needs assessment, should your problem analysis be qualitative or quantitative? And I love it. Most people tell me it should be both. And the answer is, it all depends on the question you're trying to answer. Some questions cannot be answered by quantitative data, and some questions cannot be answered by qualitative data. And some questions need both. So it's not driven by, yes, we should do both. Yes, this is the information we need to know, and this is the best method to answer those questions. And this is what we can afford to do given the resources and expertise that we have. Okay? So it's not an automatic. One says, well, should we be assessing our assets, our problems? I really like looking at both. Some people say they're assets only. I tend to like to look at both. Some never look at their assets. If you don't look at your strengths and build upon your strengths, you'll have little opportunity for success. So it is important in your needs assessment that you look at your assets, your strengths, as well as your problems. Some say, are we talking about needs assessment or surveillance? Surveillance is an ongoing data collection mechanism that assessment can use. And you can use it in your health problem analysis. So surveillance is a tool used in assessment. They're not one and the same. You use surveillance to monitor your plan's progress, but that doesn't mean that they're the same. Is needs assessment on one time or ongoing? My hope is you hear that you never have it complete. You never finish your needs assessment. Your priorities will change over time, but more importantly, my hope is that you'll better understand your priorities over time. You're going to start out not fully understanding it. My hope is before your 5 years are up, that your program understands what your priorities were and why it's the issue. Do we do it ourselves or do we contract it to somebody? Well, sometimes you need to contract because you don't have resources, but can you contract your decision making? Can you contract all of what you need to know in your problem analysis? And can they do it over time? My hope is that if you're contracting for them to feed into your planning and needs assessment and decision-making process, and that you're using them for specific roles and not as the overall responsible party. In other words, they're going to carry out certain activities that you need done, that you define that you need, but that's not it. I will always love it. One of my Title V director friends told me that he contracted out his needs assessment and he got it back a week before it was due. And he got a bottle of bourbon and spent all week fixing the needs assessment so it actually related to his state. That's not how you want to do your contracts. Is needs assessment science or art? I'm going to let you all answer this one. Is it a science or is it an art?
I think it's both.
Let's put it this way. It is an art that you use science to help drive. Decision-making, program planning is an art. It is a decision-making process that can be done in multiple different ways. The hope is that you're using science and data in that process. Does that make sense? But it's important to remember it's an art because, again, it's about decision making. It's about developing that plan. It's about monitoring that plan. It's about actions that need to be taken. And that's the art of public health practice. Your hoping is that you're going to feed that with science to drive what you do and to monitor how it's taking place. And the science is important. And the last one I put in there, it's about performance. It's not about how pretty your needs assessment is. Did it lead to the right plan, the right actions to make a difference for women, children, and families? Next slide. Any other questions? Any other thoughts? Was this helpful? Kristen, you're going to say something?
I was gonna just answer your question and say yes.
Please do.
In some time.
Was this helpful?
Please excuse me as I'm eating too. Yes, it was very much.
Okay. Very helpful. Again, I'm always amazed. Everyone does phase one of the needs assessment. They have their priorities. And for example, you're supposed to come up with strategic measures, but they haven't done problem analysis. So how do you know what your evidence-based measures should be if you haven't done your problem analysis? You're sort of guessing based off of what program you decide to do upon which you didn't have a data process to feed what you chose. I usually, when I sit there and do a block grant review after the needs assessment, I look at people's objectives and I have to ask them to explain how they got those of all the objectives that they got. Because what it looked like is they just chose objectives because they didn't have any data to go by and they thought those were the best objectives. And that may be where you're starting, guys. We've all been in those situations. My hope is that you'll get further into analysis and provide better data and better measures over time.
Yeah, I will say this presentation helped because with our team, we just put together a steering committee with different internal stakeholders to help us build this needs assessment and do it. And this presentation helped me like go back to our team and be like, okay, like we have to really share with the committee what our plan is, like what the overall vision is, what we want, even down to the framework. And that ought to help our committee understand how we want this needs assessment to be implemented. So this was helpful to like have some type of framework even to structure this vision for the overall needs assessment.
Otherwise, you're going to just be overwhelmed with data and try to piece together what the data is telling you. I always love that people present data to me and say, so Bill, what does all this mean? Well, if you didn't structure the data to begin with, you're going to be overwhelmed with just information. And that's why the program people just go ahead and do their plans because they get overwhelmed with data and they don't know what to do with it. And so that's part of the problem that I had. It's really the program people would ask for the data. They wouldn't include us in the process. And so they'd get the data, but then they didn't know what to do with it. So they just go do something. So we really failed by not starting out with an understanding of what we were trying to do and getting the information we need to do it the right thing. Well, that's the end of I have, unless you all have questions or if you have issues you want to discuss, I'm happy to hang on. If not, my best wishes to you. Please do reach out if something comes up. Kristen, you had something?
Just a quick question. If we wanted to rewatch this lecture again, we have that ability to, or yeah. Okay.
Yes, I'll be sending out the recording along with the updated slide deck too. So that will be available to you all. And then the slide deck from this summer, I can include that too, so it's in the same place and readily accessible for part 1 and part 2, since this was complimentary.
Thank you so much.
Mhm.
Thank you, Ashley.
Mhm.
Well, best wishes to you. Please don't hesitate to reach out. I'm now retired, so I have so much time. I don't know what to do. So I'd be happy to help talk with you or guide or assist you in any way I can.
Congratulations, that's exciting.
Thank you. Thank you. Yeah, I just retired this last September.
And
I now get to figure out what I'm going to do when I grow up.
you will find something to do, but enjoy your time off.
Thank you so much.
Yes, thanks all for being here. I'll follow up with some materials and an evaluation, and I also wanted to make a note too that the 2024 training course applications are open. If you have colleagues that were interested or have any questions regarding that process, please let me know or share with your networks and your colleagues in your departments. So that's available. Otherwise, thank you and take care.
Dr. Gilbert, always great to see your face, even if it's a picture.